I'm Pete Seeney from Intersurgical. We're a UK-based manufacturer of respiratory and anaesthetic products here at Arab Health. I'm a product specialist for the company, specialising in airway products. What I've got to show you is our supraglottic airway, a very unique product called the iGel. The iGel is a product that was designed and developed by a UK-based anaesthetic doctor, Dr. Mohammed Nazir. It's designed to be used in anaesthesia, first and foremost, but also can be used in cardiac arrest for emergency circumstances. What I'd like to do is just tell you a little bit about the features and what makes iGel unique and beneficial to the patient. So as you can see here, it's a device made from thermoplastic gel. The material is very soft, atraumatic. The advantages of that to the patient, it gives them very low incidence of sore throat. So once they've had a procedure, once they've had an operation, the next day without a terrible feeling of pain in their throat. It has a few more clinical advantages that we like to demonstrate to our users. It has a gastric channel down the side, which makes it a safer product because it reduces the risk of aspiration. Aspiration, certainly on a recent study in the UK, was seen to have been the biggest cause of fatality and serious complications in anaesthesia. So really it's making it a device that's a lot safer for the patient as well. Additionally, it has a good solid bite block, so as the patient emerges from anaesthesia, they can't bite down on the tube, block the airway. Again, potentially that can be very dangerous if the patient blocks the airway tube. A big advantage of the iGel, particularly in the emergency setting, is transferring the patient. Sometimes with airway tubes, as you're transferring a patient, maybe in the operating room or maybe in the emergency setting, is the fact that the device can dislodge, move and rotate. Because the iGel is wider than a conventional airway device, it's very stable when it's in place. It's designed to be used across the adult and paediatric range. We even, just to show you, 4 paediatric sizes, and the smallest device can go down to a neonate size, down to a little baby of 2 kilograms. So it's really providing benefits for people across the age range. What I'm going to do now is just demonstrate with the aid of a mannequin, not on a patient, how to use the device. Very simple device to use, easy for me to say, but better to demonstrate on the mannequin. So I'll just show you how to use it correctly. We have our patient here. Take the correct size device, which depends on the weight of the patient. To use the device correctly, you need to put lubrication on all sides of the device. But to use on the mannequin, we've simply got soap and water, just for demonstration purposes. But in an operating theatre environment, you use a KY gel, aqua gel. Be very quick to observe, so I'll talk through slowly what I'm doing. You lubricate the device. The patient has head back, chin down. You hold the device by the tip. There's no need at all to put your hands in the patient's mouth, which is a nice thing not to have to do. And you follow the hard palate till you get resistance, till it stops. When the device stops, it's fully in place, and then you tape it in place maxilla to maxilla. So a very simple device, a very quick device to insert. Really in a matter of seconds you can get a nice, secure airway. And that in a couple of minutes is the iGel. The iGel airway is really aimed to provide benefit for patients in anaesthesia, so for anaesthetic users, and additionally in the emergency setting for emergency care providers, providing benefit to both these areas, both these clinical areas. For further information on the iGel, please refer to our website www.igel.com.